Hi, my name is Megan Tarbus, and my flashcard this week is on hypertension. As everyone knows, hypertension is having a high blood pressure that's consistent every day through daily activities or even at rest. Um, the American Heart Association throughout the years have presented hypertension ranges differently, and the most up to date is a normal blood pressure is obviously 120 or over 80 or less. And systolic of 120 to 129 is an elevated blood pressure. And then the diagnosis of hypertension is 130 over 80 or higher. There are two types of hypertension that someone can be diagnosed with, essential or primary hypertension. The etiology is usually unknown, or it's due to multiple factors, or which we'll talk about later on. And of course, secondary hypertension can be from a tumor or a disease within an organ in the body that affects blood pressure. For example, a tumor on the kidneys or a disease affecting the renal system. And then, of course, uncontrolled blood pressure can lead to a hypertensive state, a hypertensive crisis, and uncontrollable blood pressure can lead to serious organ damage or even death. So we're going to talk about essential hypertension. So we need to understand, like, what is a blood pressure? What are we testing for with a blood pressure? Well, blood pressure is measuring the blood sent out through the body that's ejected within the arterial walls. The pressure systolic is that top number we're measuring, is the amount of pressure. So that's why the number is always higher. We're testing the pressure and the resistance that's throughout the body. And of course, once the blood is pushed out, the normal pressure when the ventricles are at rest, we're testing the diastolic, which is, of course, why 120 is the higher number and 80 is the lower number. 80 is the ventricles at rest. 120 is the blood leaving the left ventricle, pushing out into the walls, that initial pressure. When there is a change in the anatomy of the arterial walls, like plaque or narrowing or vasoconstriction, hormones causing vasoconstriction, that pressure is going to increase. Blood is going to be resisted, and that's going to increase the blood pressure. So that's really the pathophysiology of blood pressure, is that initial blood leaving the body through the arterial walls. And that vasoconstriction, or if there's something obstructing the blood, the pressure is going to increase. Of course, we talked about hormones that can affect the blood pressure, cause vasoconstriction. We have the antidiuretic hormone, aldosterone, in the renal angiotensin aldosterone system within the kidneys. The kidneys and the heart play the most important roles with maintaining blood pressure. The arterial walls decrease in size due to plaque, like I mentioned, or hormones releasing, causing vasoconstriction. Peripheral resistance is increased, lack of blood flow to the renal system. That's what's going to happen. So there's going to be a lack of blood flow through the heart and a lack of blood flow to the renal system. The kidneys will have a lack of blood flow, as I mentioned, and they will release organs. Renin, angiotensin, aldosterone will secrete into the body, causing vasoconstriction, increasing blood volume. And that's going to be your high blood pressure as well. So you want to manage blood pressure by eliminating modifiable factors to reduce that cycle, because if the cycle continues every day, getting higher with more plaque build up or decreased blood flow to the kidneys are going to work harder, and it's going to affect different organs in the body. Starting with the heart, if blood can't go back to the heart, it can lead to heart failure or even a MI, resulting in death or serious injury. Stroke is another effect from high blood pressure. The lack of blood flow to the brain or a burst can cause a stroke and cause brain cell deaths. And of course, the kidneys are affected by blood pressure. Chronic kidney disease is another can be caused by hypertension or diabetes. Um, the function in the GFR decreases, therefore toxins in the bodies are building up, and proteins present in the urine. Dialysis is needed for help, and the body's unable to filter out these toxins. The body's unable to maintain a regular blood pressure. They're releasing toxins to the body. And another morbidity of high blood pressure is the eyes. Retinal vessels are disrupted. It can lead to loss of vision or blindness. Again, that plaque built up can help rupture the vessels in the retina. So there's many factors if blood pressure is not maintained. What are risk factors to developing hypertension? Well, I talked about modifiable and non-modifiable. One thing that we can't change is genetics. For example, African Americans are more at risk for hypertension. That's something we can't change or modify. Things we can modify is obesity, high salt intake, poor diet, smoking, low diabetes, like the diabetes control, high heart rate at rest, like what's causing those things. We know individuals with diabetes are resistant to insulin. The body's resistant to insulin causes high blood pressure. So that's why usually when people are diagnosed with diabetes, they also are diagnosed with hypertension. Those two diagnoses correlate with each other. And then tachycardia is also a risk for hypertension. There was a study that shows that an increased heart rate and cardiac output can increase blood pressure as well. But the study also looked at like what is causing high heart rate at rest. Obesity, again, smoking cessation, smoking, high diet, and low exercise can cause high heart rate at rest, and the high heart rate can cause an elevated blood pressure as well. Signs and symptoms, there's not much evidence out there of signs and symptoms. Again, this is why this disease is known as like the silent killer, because many individuals who don't go to their doctor's appointments, who don't watch their blood pressure, can't really tell unless something happens like a stroke or heart attack, because the symptoms are very mild and non-specific. So for instance, in the book, it says fatigue, malaise, and headaches. Patient might just think they're dehydrated, or they're just not feeling well, or they're just getting older. And these individuals need to check their blood pressure to prevent the progression. If blood pressure is managed early, we can modify those lifestyle changes or treat with medication. The diagnosis of hypertension is pretty much simple as what we've been saying all along. There's no imaging or no laboratory, like we don't have to test any blood levels. It's just simply checking a blood pressure. A patient can go to CVS, check their blood pressure. They can buy a blood pressure cuff, or they can go to their doctor's office and get it checked by a nurse or a doctor. And knowing that they have elevated blood pressure, they can modify with lifestyle changes. If the blood pressure continues to be continues to be high, they can be controlled with medication and lifestyle changes. Unfortunately, this is the only way we can diagnose hypertension, is checking through the blood pressure. Again, if it's not checked, it can lead to serious outcomes. And that is my flashcard. Thank you for watching, and have a good week.